Mitch here from Vet Triage. We are going through this April 2022 edition of Veterinary Surgery. Today we are talking about comparison of immediate and short-term outcomes of cricoarytenoid and thyroarytenoid lateralization in dogs with idiopathic laryngeal paralysis. For those who want to know more about laryngeal paralysis, just search my YouTube channel. I have many laryngeal paralysis talks that I've given on this topic, and it's one of the videos, actually one of my most popularly viewed videos. So check that out. It'll go into more detail. So I am going to skip some of the more basic stuff about laryngeal paralysis here. A couple things to talk about too with regards to the title. If you look at the drawing down below here, you can see here the cricothyroid articulation. So that's where the thyroid cartilage is, which is here in purple, is interacting with the cricoid cartilage, which is in this lime green color. So that articulation there is one surgery that they are testing. The other surgery they're testing is thyroarytenoid lateralization. So if you see again the purple here, and then the articulation with the arytenoid and cricoid here, that's the other attachment. And so the question is, do you place the suture that's going to create the permanent abduction of the larynx by disarticulating this joint or this joint? Does it matter which one in order to get the suture around to the arytenoid cartilage? So that's in a nutshell what they're trying to test here. The objective is to compare the immediate and short-term outcome of thyroarytenoid lateralization and cricoarytenoid lateralization for the treatment of canine laryngeal paralysis in dogs. Prospective clinical trial, 14 dogs. They looked at the pets at immediately post-operatively and then 15 days post-operatively. So not a lot of animals, but we also don't get the opportunity a lot of times to resedate them, to look in the larynx at 15 days post-op, especially if they're doing fine. Most pet owners don't want to do that, so that's kind of cool. And by the way, this study does come out of Milan, Italy. Results showed the rheumatoid area increased by a mean of 152% post-op and 127% post-op, 15 days post-op for the thyroarytenoid lateralization group, and 205% post-op, 199% at 15 days post-op for the cricoarytenoid lateralization group, compared with preoperative values. The increase in the rheuma area differed between the two groups at all post-operative time points. A reduction of the area occurred at 15 days post-op for both groups. There was no difference between immediately post-op and at 15 days post-op for the cricoarytenoid lateralization, but there was a large difference in the thyroarytenoid lateralization group. The conclusion was that although there was a reduction in the rheumatoid area in the thyroarytenoid group, they observed no associated clinical signs with that. Okay, introduction. It was recently shown that this disease, idiopathic laryngeal paralysis, is part of a generalized neuromuscular disorder and geriatric onset laryngeal paralysis polyneuropathy, which was suggested to be a more accurate term. Branches of the recurrent laryngeal nerve are affected, including the pararecurrent laryngeal nerves, which innervate the cervical and cranial thoracic esophagus and trachea. Esophageal dysfunction, including megaesophagus, is a finding in dogs with laryngeal paralysis and is a risk for aspiration pneumonia. A larger increase in the rheumatoid area was seen in dogs that underwent cricoarytenoid lateralization compared with thyroarytenoid lateralization in another study. And again, I'm going to criticize this aspiration pneumonia because we always assume that if a dog is prone to aspiration pneumonia, meaning that they aspirate gastrointestinal contents into their lungs and develop pneumonia, that is due to aspiration. The problem is with that is if you don't know for sure they aspirated, that bronchopneumonia, which is the general term for pneumonia, can be caused by any myriad of factors, not just aspiration. So I really think it's a problem with our veterinary field that we constantly use the word aspiration and we don't acknowledge the fact that you can't really prove it's aspiration unless you confirm that there are gastrointestinal contents within the pulmonary space, which none of us do. So, or unless you saw the dog actually vomit or regurgitate and then the contents went in the lungs. Otherwise, you don't really know. It should be suspected aspiration or just bronchopneumonia for a variety of reasons. Materials and methods. What's interesting about the materials and methods here is the surgical time was not recorded for these dogs. That's crazy. I don't know why you would even allow that to be part of the study. why you wouldn't include that, why you wouldn't measure that. Like, that should be data that's collected. My suspicion is that outside of North America, other institutions don't have as tight of medical records as we do in the United States. But otherwise, I don't know why you wouldn't include that information. So here is a picture of the larynx of a dog that underwent the cricoarytenoid lateralization surgery. You can see how from A to C the opening is wider, and then for the thyroarytenoid lateralization, you can see here again A to C. Notice how C in this one is lost some of its diameter compared to B, and so that's at 15 days post-operatively that those dogs lost some diameter. All right. Results. The mean age at the time of referral was 11.3 years old. Labrador retrievers were most common. Females were most common overall. Female spayed. Mean weight 33.3 kilograms. 57% of cases had changes in phonation, meaning vocal cord changing or voice change. The increases in the rheumatoid area in the cricoarytenoid lateralization group was from 180% to 248%, with a mean of 205% at post-op, and a range of 169 to 240%, with a mean of 200% at 15 days post-op. In the thyroarytenoid lateralization group, the increases were from 128% to 185%, with a mean of 152% immediately post-op, and then at 15 days post-op, 100 to 162%, which is an average of 127%. The decrease from immediately post-op to 15 days in the cricoarytenoid group was 5% and 25% in the thyroarytenoid group. The results of the two groups differed at both time points. The cricoarytenoid group areas measured at post-op and 15 days post-op differed from the preoperative area, but the areas at immediately post-op at 15 days post-op did not change too much. In the thyroarytenoid group, the preoperative area differed from the area measured immediately post-op, and the areas immediately post-op and at 15 days post-op compared to preoperative and at 15 days did not differ. No post-op complications occurred. All right. One second. Okay. All right. For discussion, the signalment, history, and results of the physical examination and laboratory testing were diagnostic for idiopathic laryngeal paralysis in old dogs. No, they weren't. So if you call something idiopathic, it means that it's for unknown cause, unknown reason. You don't know what caused the disease. So you can't prove that. Now you can say you proved it from exclusion, meaning that you've disproved everything else that can cause it, but to word it this way, to say that they were diagnostic for idiopathic laryngeal paralysis is insane. That's not true. You can say that the lack of evidence for the other differential diagnoses suggests these dogs had idiopathic, but unless you actually biopsy the recurrent laryngeal nerve and its branches and the cricoarytenoideus dorsalis muscle in dogs that have laryngeal paralysis and confirmed that they had degeneration of both nerve and or muscle for unknown reasons, then maybe that's confirmation of idiopathic laryngeal paralysis, but otherwise this is a terrible line. A male predilection for this disorder has been reported. Labrador Retriever was most common and represented 50% of our population. A reduction in the rheumatoid area occurred at 15 days post-op in the thyroarytenoid group, and there was a smaller decrease in the cricoarytenoid group, but this finding was not associated with clinical signs in either group. The reduction it wasn't associated with any clinical signs. The strong decrease in the rheuma area from post-op to 15 days post-op in the thyroarytenoid group was likely associated with abduction of the thyroid cartilage to access the cricoarytenoideus dorsalis muscle and the cricoarytenoid articulation during surgery. Fixation of the thyropharyngeus muscle in its normal anatomic position allowed adduction of the thyroid cartilage to its physiologic position near the cricoid cartilage. This movement may have resulted in the relaxation of the tension suture between thyroid cartilage and the muscular process of the arytenoid cartilage, thereby decreasing the rheumatoid. That's just saying that the surgical technique for the thyroarytenoid lateralization maybe altered the tension of the suture that's supposed to cause a permanent abduction in the larynx, and maybe that's why they had not as great of an outcome, although clinical signs were not evident. The results suggest that although cricoarytenoid lateralization results in a larger increase in the area, it provided no short or medium-term advantage over thyroarytenoid. Now again, the title of this paper is Immediate and Short-Term Outcome. Then they sneak in this line of saying it provided no short-term or medium-term advantage. Medium-term was not defined in this paper, nor was it measured, nor was it even in the title. So that's also bad. This paper is poorly written. Anyway, all right. Let's see. And functional testing to rule out megaesophagus was not done in these dogs, which they said is a limitation in the study. I actually don't think it was a limitation in the study, because you shouldn't need functional testing for megaesophagus. If you don't see it on radiographs, then we're done. None of these dogs had any neurologic issues. So if you're concerned that maybe the dogs had neuromuscular disease but no megaesophagus because of neuromuscular disease, well, there are diagnostic tests for that, but also the dogs would have had neurologic deficits. And they said in their exam that these dogs didn't have any neurologic deficits. So unfortunately, this paper does get quoted a lot. In fact, I quoted it in my in my talks, and the findings are fine, I guess, but they need more dogs. And also there are a host of other issues with this paper that I don't agree with. I don't think these problems affect the outcome of the paper necessarily, but it's just poorly written and poorly designed. So anyway, thanks for your support. We'll see you again in the next one. Take care.